1. When designing ABMDI training, which method best ensures learners can apply investigative procedures in real scenarios? A. Memorization drills. B. Case-based simulations. C. Multiple choice testing only. D. Daily lecture recaps. 2. Which evaluation tool is most reliable for assessing an investigator's competency in death scene documentation? A. Oral questioning. B. Checklist with standardized criteria. C. Peer discussion. D. Group brainstorming. 3. In curriculum development for medical legal death investigation, what is the first step? A. Writing test questions. B. Identifying learning objectives. C. Scheduling course dates. D. Preparing handouts. 4. Which communication strategy is most effective when interviewing grieving families during an investigation? A. Technical jargon to maintain authority. B. Active listening with empathy. C. Rapid questioning to gather facts. D. Avoiding eye contact. 5. According to ABMDI regulatory standards, how should sensitive case files be maintained? A. Stored openly for team access. B. Secured under chain of custody protocols. C. Saved to personal devices for convenience. D. Shared via email without encryption. 6. When mentoring a new investigator, what technique promotes long-term professional growth? A. Assigning tasks without feedback. B. Demonstrating best practices and debriefing. C. Limiting responsibilities. D. Providing only written manuals. 7. Which adult learning principle emphasizes connecting new knowledge to prior experiences? A. Andragogy. B. Behaviorism. C. Pedagogy. D. Rote learning. 8. What is the primary purpose of formative evaluations in ABMDI training? A. Certify final competency. B. Provide ongoing feedback. C. Rank learners. D. Replace summative testing. 9. When revising an ABMDI training curriculum, which factors should be prioritized? A. Instructor convenience. B. Updates in investigative standards. C. Reducing course hours. D. Learner complaints only. 10. Which communication approach reduces bias when testifying in court? A. Using neutral and factual language. E. Emphasizing personal opinions. C. Avoiding evidence details. D. Over-explaining with emotion. 11. A key regulatory compliance step in medical legal death investigation is A. Ignoring HIPAA restrictions. B. Following jurisdictional reporting laws. C. Allowing unrestricted media access. D. Delaying mandatory notifications. 12. Which mentoring practice most effectively builds problem-solving skills? A. Asking probing questions after observations. B. Providing all answers directly. C. Avoiding learner mistakes. D. Assigning repetitive clerical tasks. 13. Which instructional method best addresses diverse learning styles in ABMDI programs? A. Solely lectures. B. Mixed methods including visuals and practice. C. Reading assignments only. D. Group debates only. 14. How should trainers evaluate the ability to conduct unbiased death scene interviews? A. Multiple choice exam. B. Role-playing with feedback. C. Short answer quiz. D. Attendance record. 15. Which curriculum element ensures alignment with ABMDI certification standards? A. Accreditation requirements. E. Instructor preferences. C. Budget limitations. D. Student feedback forms. 16. When a death investigator communicates with law enforcement, clarity is best achieved by A. Using standardized terminology. B. Speaking in generalizations. C. Withholding technical details. D. Providing only minimal notes. 17. Which regulation must ABMDI professionals observe when handling toxicology samples? A. HIPAA confidentiality. B. Chain of custody procedures. C. Freedom of Information Act requests. D. Personal preference. 18. A mentor demonstrates ethical practice to a trainee by A. Ignoring mistakes. B. Modeling professional conduct. C. Withholding feedback. D. Delegating without instruction. 19. Which adult learning strategy increases retention of investigative protocols? A. Repeated practical application. B. Passive listening. C. Note-taking only. D. Memorizing legal codes. 20. What is the main goal of summative evaluation in ABMDI training? A. Certify competency. B. Provide informal feedback. C. Identify study preferences. D. Encourage casual participation. 21. Which step in curriculum design ensures training meets professional demands? A. Needs assessment. B. Printing manuals. C. Assigning grades. D. Writing evaluations first. 22. The most effective communication strategy in interagency collaboration is A. Establishing clear information sharing protocols. B. Using informal messaging. C. Relying on assumptions. D. Limiting contact. 23. Which compliance principle applies when releasing investigative findings? A. Protecting confidentiality. B. Sharing broadly with the public. C. Ignoring records requests. D. Allowing unverified reports. 24. Which mentoring activity fosters independent decision-making? A. Guided problem-solving exercises. Avoiding trainee involvement. C. Giving all correct answers immediately. D. Restricting responsibilities. 25. Which teaching method is best for evaluating judgment in ambiguous death cases? A. Scenario-based analysis. B. True-false tests. C. Multiple-choice exams. D. Fill-in-the-blank quizzes. 26. Which curriculum principle ensures learners achieve the intended outcomes? A. Alignment of objectives, instruction, and assessment. B. Reducing content for efficiency. C. Using outdated materials. D. Limiting assessment tools. 27. In crisis communication with media, investigators must prioritize points. A. Accuracy and confidentiality. B. Personal opinions. C. Unverified speculation. D. Withholding all information. 28. What is the primary regulatory standard guiding evidence collection? A. Chain of custody integrity. E. Investigator discretion. C. Media pressure. D. Speed of collection. 29. Mentors should provide feedback that is A. Specific and constructive. B. General and vague. C. Delayed and inconsistent. D. Rare and minimal. 30. Which adult learning approach emphasizes problem-centered training? Experiential learning. B. Traditional lectures. C. Memorization drills. D. Abstract theory only. 31. When evaluating ABMDI trainees, a rubric ensures A. Consistency and objectivity. B. Instructor bias. C. Informal impressions. D. Learner popularity. 32. A key element of curriculum review in ABMDI training is A. Alignment with updated laws. B. Instructor convenience. C. Cost-saving measures only. D. Student complaints. 33. Which communication practice reduces misunderstanding across agencies? A. Using standardized reporting formats. B. Informal verbal updates. C. Handwritten notes only. D. Relying on memory. 34. The most critical compliance obligation when handling autopsy records is A. Confidentiality and restricted access. B. Broad sharing with media. C. Ignoring record requests. D. Archiving without security. 35. A mentor ensures skill mastery by A. Observing and coaching in real time. Avoiding learner mistakes. C. Delegating without instruction. D. Assigning repetitive paperwork. 36. Which adult learning method is best for complex investigative scenarios? A. Case study discussions. B. Silent reading. C. Memorization quizzes. D. Instructor monologues. 37. Evaluation methods that require demonstration of skill are called dash. A. Performance assessments. B. Self-reports. C. Attendance checks. D. Written surveys.